Hi, Amber.
Hi, Lori.
Thank you so much for joining me today. We have so many people in our classes who ask about pelvic floor therapy, and what it means and what it does. And honestly, I've never seen a pelvic floor therapist. So I
Mhm.
really need you to answer those questions for us so that our moms know the incredible value of having a pelvic floor therapist. So before we launch into that, will you just tell me a little bit about yourself and being a pelvic floor therapist and your life in general?
Yeah. Thank you so much for inviting me to chat. It's something I'm super passionate about. Pelvic health and just women's health in general is very much needed, and not a lot of people know about it. Like you said, even yourself, you haven't been to one. And so sometimes it can be a pretty intimidating thing for sure. So with myself, I'm a mother of three. I've had a singleton and twin girls. And that itself has really fueled my passion for working with pregnancy and postpartum because I know firsthand how difficult it is. Pregnancy isn't always easy and it's not always rainbows and butterflies. Sometimes you need a little bit of help. And sometimes you just need support of knowing what you should or shouldn't be doing, and guiding you through prepping for birth for sure is super valuable. And then obviously postpartum, you're recovering from a big major event. And for some women, you're recovering from major abdominal surgery. So it's not something that you should just, wait and see or, let go to the wayside, because if you're not healthy and not moving well, not functioning well, that's going to impact how you're interacting with your newborn baby too. And so that's something that moms, we tend to put ourselves on the back burner. And I just encourage women to at least take a little bit of time to take care of yourself. So that way you can have the best postpartum experience and have the best bonding experience with your newborn or newborn sometimes, in certain cases. So, that's what I'm all about. That's what I'm passionate about. I've been doing pelvic health for about 3 years, but I've been a physical therapist for about 10 years. So I've been working with people for a very long time. And so, yeah, I'm excited to be able to spread the word and bring some more awareness to this topic.
That is so cool. Do you mind if I just ask you some of the most commonly asked questions that we get about things I think you will be able to help us with?
Absolutely.
Cool. Okay, so question number one that we get all the time is about pushing. Like people say, what are the best positions for pushing? When should I practice pushing? Um, that's like one of the major topics that come up. And I do have a perception that pelvic floor therapists can help you with pushing and, the best way to practice. So can you speak to that?
Absolutely. Yeah, this is the number one question I always get during pregnancy as well. Even if I'm just talking to somebody on the street, is so how do I push this baby out? And so, the best time to start practicing is honestly earlier in your labor. Being able to prep your body to stretch and open and get into the birthing positions that are comfortable to you. So, if you plan on birthing in a different position other than the typical on your back, legs up in the air, which we know by research isn't the greatest position to push in. If you want to do it on hands and knees, if you want to do it in squatting or standing, then you should probably be practicing those movements early on in your pregnancy. So as you're getting a little bit bigger and, things are getting a little bit more uncomfortable, or your weight is shifting different positions, that you're being able to keep up with that shift throughout your pregnancy. So I always encourage some of the really early prepping stuff, kind of in end of first trimester, second trimester, to start practicing getting into those positions, being able to stretch, relaxing your pelvic floor muscles, and all that fun stuff. When it comes to the actual prepping for the pushing part, for when you're more in the active labor of pushing baby out, you usually start that around 36 weeks, in a normal pregnancy. If you're planning, if early induction for any reason, then we want to start maybe a little bit earlier. So, give yourself about a month before you're planning to be induced or have your baby to start prepping the actual pushing part. And that's when we can talk about different methods of pushing and which one may be more doable for your body, because not everybody births the same way. So in pelvic PT, when I'm working with the clients, we test out different birthing positions. We try to figure out which one your body relaxes most in, which one feels most comfortable. We can do actual pelvic floor testing in different positions to see which position the pelvic floor relaxes the most in. So we tend to do that in about the last, 4 weeks before delivery when you're in person with a pelvic PT, which can be really helpful because sometimes you don't know where your body relaxes the most in, and being able to actually physically assess the pelvic floor in different positions can be very, very helpful. And being able to practice different methods of, there's kind of two big schools of thought for pushing. There's the open glottis, and then there's the closed glottis pushing. And I encourage women to start practicing that in the last few weeks before delivery as well, to see which way their body seems to respond better to. And so we talk through that in pelvic PT too, of what is open glottis pushing, and that's where you're more of like breathing through the push and you're not holding your breath, whereas a closed glottis, you're holding your breath, and that's what a lot of people will call like the purple pushing. And so sometimes some women do much better with closed glottis than open glottis, and so we want to practice that and see which one you respond better to.
That's brilliant. And are those things that you can practice like on your own, and you kind of figure out how to do that work? Like, do they need to come in and see you, or could they meet you via like this, like Zoom or something like that?
Yeah. Yeah, so most of the time you can do it on your own and do it more virtually like this, especially with the pushing part. So with the closed glottis versus open glottis, that's easily to coach over, virtually. Um, and usually I have people to start practicing that with like bowel movements. If you're having to do a little bit of pushing with a bowel movement, that's very similar to how you're going to mechanically push out baby during birth. So, I teach people how to do both, and then they try it when they're on the toilet. And so that's a great way for them to practice and kind of decide for themselves which one is better. If you want the actual, what we call biofeedback, to be able to tell, is the pelvic floor muscles really relaxing during, hands and knees versus squatting versus on your back, that's when we want to be in person because we can't do that quite virtually. But you can kind of guess, gauge yourself, get in those positions, check in with your body. How does it feel? Do I feel comfortable? Can I breathe? Can I get relaxed? Can I let my muscles, open? So you can kind of gauge it on yourself, but to get a full picture, that's where the in-person can be really helpful, especially if you're like, I have no idea what's happening in my pelvic floor. I cannot feel it. Like, what's happening down there? I don't know. That's when in-person can be really helpful.
Yeah, yeah, I'm sure. I love though that for people like you who have 3 kids under 3 at home, they could actually hop on Zoom with you,
Mhm.
to at least get started or start assessing like what needs are there for them. I'm sure there are people
Yeah,
like me who don't know like about pelvic floors or are not particularly in touch with their pelvic floors. So it'd be helpful just to talk to you.
absolutely. Yeah. So virtual can make it very easy. So you don't have to get out of the house if you have a young kid at home already. So makes it more accessible.
Mhm. And are there like contraindications for practicing pushing? Is there something like don't do this if you're, bleeding or whatever? I don't.
Well, yeah, obviously, if you have any signs of early labor or preterm labor, then I would recommend really not practicing as much of the pushing and just practicing different positions and relaxing. Or if you're having any high risk, issues at all, then we want to be a little bit more careful. Like if your blood pressure is getting a little bit out of control or getting a little bit higher and we're monitoring it, then we want to be more careful because especially with closed glottis pushing, that can increase your blood pressure a bit. So there are some things you want to be a little bit cautious of depending on your circumstances. But if you have a healthy, really, looking normal pregnancy, then there shouldn't be any major contraindications. If you have a known prolapse where you have some of the organs starting to fall out, then we also want to be a little bit cautious. Obviously, if you're having some prolapse and you're also planning a vaginal birth, we have to kind of balance those two out. So we don't maybe go as intense with the pushing prep with somebody who has a prolapse. So yeah, just a few things that you would want to be a little cautious of.
So that actually makes me think of another question, which is I've had several friends who have had bladder or uterine prolapse, and I'm wondering how you deal with that, like in general, but with pregnancy. If there's a pregnancy and you've got a bladder that is problematic, how would a pelvic floor therapist help with that?
Yeah, that's a great question. It gets tricky when you're in a pregnancy because obviously you're getting more and more pressure down on that bladder or whatever is prolapsing. So, we can't 100% prevent it if it's already happening, but what we can do is teach you techniques to try to stabilize it. So we do a lot of strengthening around the pelvic floor and your hips and around your pelvis to try to give stability and support. So that way we can try to minimize as much of that prolapse and take some stress off of it. There are some supportive devices we can recommend as well that specifically support the pelvic floor muscles. So instead of just wrapping around your belly, like most of the pregnancy bands, there are some that actually wrap under on the pelvic floor to give you some support. So sometimes those can be super helpful.
Cool, cool. Um, if you have had a C-section, do you still need pelvic floor therapy, or do you only need pelvic floor therapy if a baby has gone through your vaginal canal?
Yeah, yeah. This is a big misconception that people think that, oh, I had a belly birth or, well, C-section, that nothing happened to my pelvic floor. It's fine. I don't need pelvic floor PT, but that's actually not true. There's a lot of benefit we can have for C-section mamas. The first thing is you carried a baby for 9 months and you had all that pressure on your bladder, your rectum, your pelvic floor. So even if you didn't deliver through your pelvic floor and the vagina, you still have dysfunction there just because of being pregnant. And, that's a lot of stress and a lot of strain for a long period of time. So, that's always helpful. But also, we work on abdominal work. So, we work on your C-section scar. We make sure that you don't get any scar tissue or adhesions in that area, which can start impacting pain and other functions. So it is super valuable for C-section moms to come in as well because, you know, that's a major abdominal surgery that they had. It's like if somebody had a rotator cuff repair and then they just went home and didn't do anything. It's basically the same thing. They cut through, 7 layers of tissues and muscles to get that baby out. So we want to make sure that you get that function back in your abdominal muscles, you don't get any scar tissue, and you're breathing appropriately, all that fun stuff.
How long do you have to wait after you've had a C-section to see a pelvic floor therapist?
Typically, the rule of thumb is if they've been cleared at their 6-week follow-up, then they could come in for pelvic PT. So I have seen some moms earlier than that. What we typically do is don't do any internal vaginal work in that 6-week area just to decrease the risk of infections. But if they're coming in sooner than that 6-week checkup, then we'll just get a clearance from their OB or midwife or whoever saw them and make sure that the scar is fully healed. Once it's fully healed and closed, then we are usually good to go.
Cool. So, and follow-on question, is having pelvic floor therapy helpful if you are seeking a VBAC or a vaginal birth after cesarean?
Yes, absolutely. I think the VBAC moms are some of the biggest ones we can have a lot of impact on because we want to make sure you don't have any leftover scar tissue in the abdominal area that might impact how well your uterus can push baby out or impact positioning you may be able to do for birthing. And also to check in on the pelvic floor to make sure that you're able to, contract and relax and all that fun stuff. So and we also get just a lot of support, we are there not only physically, but mentally. And sometimes, you have a lot of stress and anxiety with preparing for VBAC. And so, we're there to help you along the way and guide you. So yeah, I think VBAC moms can have a lot of benefit.
Yeah, that's great. If you have had 0 kids before, or you're on your second or third kid, is there a difference with how you would care for your pelvic floor or do exercises for your pelvic floor?
Yeah, I think there are some minor differences depending on a few variables. If it's your very first one, I would say the biggest thing is making sure you can connect in with your body, connect with your pelvic floor, and find those areas to be able to relax. And so, it's your first time, you don't know how your body's going to respond. You've never been through it. You've got a lot of stress and probably lots of questions. So in a first baby mom, I will work a lot on just education and teaching different techniques with the different pushing techniques, different positions and stuff like that, and just preparing them overall for, okay, you're aiming for a vaginal birth, but let's just make sure that you have all the options on the table because sometimes things happen. And so, reminding people that it may not 100% go like you want to. But if it's your second child or third child, it kind of depends on how that first or second birthing process went. So if you had an uncomplicated birth for your previous child or children, then there's probably less we'll have to do because it seems like most of the time in that case, if you've had uncomplicated, easy, quote unquote, easy childbirth, and I don't think it's ever easy, but that's just my opinion. Then your body is doing a pretty good job. And I feel like you're probably really equipped already to do a lot of excellent pushing and positioning. But if you had a complicated first or second birth before this pregnancy, that's when we want to do a lot more work, checking out, did you have an episiotomy or any tearing in that first pregnancy that maybe there's some scar tissue that might be in the way of letting the pelvic floor open and let baby out? And we need to work on loosening that up before you get into the later stages of pregnancy and get prepping for birth. Or are they having a lot of issues with pelvic floor tightness, which can happen after your first birth? Especially if you've had trauma or tearing during the birthing process, those pelvic floor muscles can go super tight to try to protect and guard. And if that's the case, then it's going to be really hard for those pelvic floor muscles to stretch and open and relax and lengthen. So, we always want to check to see, is the pelvic floor able to relax and open? If it's way too tight, then we do a lot of work on stretching those tissues, opening those tissues, both the patient doing it themselves, plus we also do it in the clinic as well, doing some intravaginal stretching and teaching you how to do that at home to make sure you're able to relax and get those muscles to calm down and open for baby to come out. So it kind of depends on what your previous births look like, if we're, looking at something easy or more challenging.
Um, Also a wonderful setup for the next question that's popping into my head, which is probably the second most asked question is, how do I avoid tearing? And I would assume a pelvic floor therapist could help with that. Is that true?
Um, yes, I'm gonna put a big asterisk here. Based on research, we know that certain things, like doing perineal massaging and stretching beforehand, doesn't necessarily decrease your risk of tearing. So we cannot say 100%, like if you do these things, you will not tear, because we can't guarantee that. But I do feel like if you've gone through pelvic PT, you've learned how to stretch and relax your pelvic floor, work on your breathing mechanics and things like that. In my experience, anecdotally, I feel like women come back and have a better experience. And they'll have, maybe instead of having a third-degree tear, where it's tearing through the whole entire pelvic floor muscles, maybe they're just left with a grade 1 or grade 2 tear, which is not through the muscles. It's more just superficial on the skin and some of the tissues underneath the skin. So, in my experience, I think it does help. Can we say 100% it prevents it? No. But I think in my experience and in the experience of the other pelvic PTs that I know and talk to, I think it's super helpful and maybe can decrease the level of tearing, but not necessarily prevent the tear.
Decreasing a level of tear any amount is a huge help. That's like one
Absolutely.
of the things postpartum is recovering from tearing. So it's a fair question. So
Yeah, absolutely. And a grade 3 tear is really pretty severe, right? It's going through those pelvic floor muscles. And so if we can decrease that and just keep it a little more superficial, you're going to recover much faster and you're going to probably have less issues with muscle function afterwards and, maybe less scar tissue. So yeah, absolutely. Decreasing the tear is a big deal.
yeah. Which every woman who's ever had a tear knows. So yeah.
Yes, absolutely.
Yeah. I did not ask you about this ahead of time, but I'm going to ask you about it now. So if this doesn't feel like a good question, I'll cut this out.
Okay.
So we work in our organization with a huge number of very vulnerable folks who have a history of trauma quite frequently. And going through the Postpartum Support International training, one of the things that they mentioned is that working with a pelvic floor therapist can help very much with decreasing postpartum mood disorders. I was trying to figure out why that made sense or why that would work, and how trauma-informed care or pelvic floor care could help with both like the fear of birth, the trauma of birth, or the trauma of a sexual abuse history, perhaps, and making it through birth in a kinder, gentler way, or coming out on the other side a little bit better. That's kind of a very long, rambling question, but does that make sense? Like,
yeah. I think I'm following with where you're going with this, but I mean, we get trauma-informed care when we go through pelvic floor PT because there's a lot of women and men or trans people who have had a history of trauma. So we work on that a lot in pelvic PT, even if we're not going through a pregnancy. But the issue comes when you're pregnant is if you had a previous, especially like previous birth trauma, a traumatic experience, didn't go the way you wanted to, things turned out, you had to have episiotomy or you had a major tear or you had a C-section when you were planning a vaginal birth, all that can be trauma to the patient. And so our goal in pelvic PT is to help calm the nervous system down, teach you how to calm your breathing, calm your body, so that way you can go into that experience with a little bit more awareness and a little bit more compassion for yourself. So that way you're not going in with unrealistic expectations or going into it with your nervous system already, at max level, and you're going into an already, super stressful event. Childbirth itself is stressful. But if you're already high stress and then you're adding on the stress of childbirth, that can be a lot to handle. So pelvic PT, we do a lot of down training on the body system, teach you how to meditate, teach you how to relax, try to calm your body a bit. So that way, hopefully you're walking into the experience in a little bit better of a stressful state, a little less stressful and a little bit more relaxed, hopefully, as much as we can, at least. So I think that's where we have a big impact in that way. But also, you got to think about how the body holds on to stress, right? So there's a really great book called The Body Keeps the Score. I can't remember the author, but basically it's,
Mandel quote.
yeah, exactly. Yeah, he doesn't necessarily talk specifically about sexual trauma per se, but he does touch on it. But anyway, the idea is that your body holds on to that stress and that trauma within the musculoskeletal system, within your nervous system. And so that's where we can come in and say, you're holding your stress in your pelvic floor. You're gripping really, really tight in that pelvic floor because you're scared of the birthing process. You're scared of that trauma happening again, or you've had previous trauma in that area from sexual abuse or whatever. So our goal is to go in there and try to teach the patient how to let go of that trauma, let it out of your musculoskeletal system, let it out of your nervous system. So that way your body is in a little bit better of state to prep for birth.
Yeah. Yeah, absolutely. You had talked about like a tight pelvic floor. And I've had several clients who were athletes
Mhm.
for birth. And oftentimes it feels like it's almost harder for them, even though they've done Kegels or whatever, because their pelvic floor is so tight. Do you have thoughts about like basic exercises or basic pelvic floor care that
Mhm.
women can do, whether they're pregnant or not, and if Kegels are a good idea?
Yeah, I mean, this is a big problem we see. I mean, a lot in the athletic population for sure, because they're just always training, getting stronger, but don't always do a great job at, what we call cross training, basically doing something that counterbalances the effect of doing a lot of heavy weightlifting or powerlifting or running or whatever your sport is. So yeah, a lot of times for athletes in particular, you can get really tight in that pelvic floor. And the problem is then, people think, oh, I'm really tight in my pelvic floor. I must be super strong. And that's not the case. So the issue is if you're always really tight like this in your pelvic floor and you can't bring those muscles back down to a resting position, then you're going to have issues with bowels. So you're going to have constipation. You're going to have more hemorrhoids. You're going to have potentially more risk of tearing during childbirth because they're so tight they can't relax back down. Um, and it can lead to actually more pain. So you can have not only pain in the pelvic floor, but you can have pain in the pubic symphysis, which is that, deep groin bone right in the front of your pelvis. You can have pain in your back. You can have pain in your hips. So all that tightness, we think, oh yeah, they're tight, so it must be strong. But that's not necessarily the case. You can actually have a lot of urinary leakage when you're really tight because the pelvic floor muscles are so tight they can't contract when they need to. So, tightness is a major issue. And it's actually one of the more common things that I treat in the clinic is more of the overly tight pelvic floor versus the super weak pelvic floor. So the best thing to do is to not do Kegels. Avoid the Kegels. And also you want to be careful of doing a lot of aggressive abdominal strengthening or hip strengthening because a lot of those muscles in your abdominal area in your hips connect to the pelvic floor. So if you're doing a ton of planks and you're doing a ton of sit-ups and stuff like that, that will inevitably cause the pelvic floor to tighten as well. So I always tell people if you are a really high level trainer and do lots and lots of, athletic events or, powerlifting or whatever it is you're doing, you need to focus on stretching. Do some restorative yoga. Focus on, 15, 20 minutes a day of doing some guided stretching on YouTube or wherever you want to do it. But you need to focus on relaxing, stretching, letting things open and lengthen versus doing more strengthening. Um, especially if you're prepping for birth. So that's my biggest recommendation. Do not Kegel, be cautious of lots of extra core strengthening, and focus on relaxation and stretching.
Very good. If people wanted to find you, I know that there's pelvic floor therapists are in high demand right now. How
Mhm.
did they find you? And do you come to people? Do you have an office? Like all that stuff.
Yeah. So my company I have is called Catalyst Physical Therapy. I'm in Tucson, Arizona. My clinic is right by St. Joe's Hospital. I don't do in-home care. People come to my clinic. But if you're a new mom and you got a young baby, I do have a setup to have a pack and play so you can bring baby and have baby hang out in the pack and play while we work on your care or whatever. So I try to keep it very welcoming for moms, so you don't have to find a babysitter for baby or toddler or whatever you have at home. You could always bring them with you, and that's perfectly fine. Um, my clinic, I have lots of space. So, if you've got an older child, so like more of a, 10-year-old or teenager, they're also welcome and they can hang out and color or whatever. So, um, If you're looking for a pelvic PT and you're interested in my care, you can find my website, catalyst-physicaltherapy.com. Um, you can also, if my area of town, you live more in Oro Valley or Marana and you need something a little closer to home, there's lots of other great pelvic PTs all throughout Tucson and other states, obviously, and everywhere. So you can always go onto the APTA Pelvic Health website, and they have a directory for pelvic PTs. If you need somebody in a different city or town or whatever, you could always find those directories and find the pelvic floor PTs around you. And so those are always really nice if you're looking for something closer to home.
Well, I'm glad you're here. I know that we have amazing pelvic floor therapists here. Hello, amazing pelvic floor therapists. But I also know that they're really, they're backed up. So we need more of you.
Yeah.
So I'm very,
Yeah. I mean, thankfully there's growing. We're getting more pelvic floor PTs as the years go on, but yes, there's still not enough of us to go around. So I'm always happy to help another person find a pelvic PT. If I'm not the right person for them, I'm happy to help you find the right one. Because ultimately I want women to get care. And so if it's not with me, that's okay. I will help you.
I love that. One of the questions that I have is there a way to gauge where you are in relation to your pelvic floor? Like, how do you get in touch with your pelvic floor?
Yeah, so this can be really tricky if it's something you've never thought about, like, oh, I don't know what's going on down there. I don't even want to think about it. I think that mentality is getting better as the decades go on, but especially if I'm working somebody who's a little bit older and this was a very taboo topic, then the biggest thing is, sorry,
Mine too.
crazy dogs. Yes. Hey, guys, stop it. Um,
See, it's a taboo talking. They don't even want to hear about it.
no, they're tired of hearing about pelvic floors. So, um, see if we can get them to calm down. So yeah, getting in touch with your pelvic floor, the biggest thing is just bringing awareness. So this is where something like meditation, this is not something I am great at. I'm still practicing it myself quite a bit, is you need to take some time to feel your body. And that's where some meditation can be really great. And there's some guided pelvic floor meditations on YouTube that are free or fantastic. So, that's the first thing is you need to get in touch with your own body. And so doing some meditation can be really helpful. But the biggest thing is if you're not sure, am I tight or am I weak? Then I always ask people, what are your symptoms? If you're having a lot of constipation and straining, a history of hemorrhoids, you can't tolerate sitting very well. If you wear tight pants, you feel uncomfortable. That's usually a sign that you're too tight. And that's when you want to focus on more stretching. If you have more issues of, I'm feeling kind of unstable, I get a lot of clicking and popping, I can't stand or sit in one position for very long, and I have to always wiggle around. I'm feeling like things are falling out and it's super heavy down in my pelvic floor. That's when you are usually maybe a little more weak and you need to focus on doing some Kegels and more strengthening. So those are the two things is trying to gauge, am I too tight or am I too weak? And you can kind of gauge based on your symptoms. The other thing is you can feel down there, right? So you can go to a pelvic PT and we'll tell you if you're tight or not, but feel on yourself. Can you insert your own finger into the vaginal area and feel around? Is it painful to do that? Then you're too tight. If it's not painful, and you're having issues with urinary leakage, then you're probably more weaker. If you're having pain with sex or you can't put a tampon in, then obviously you're too tight. Those things should not be painful. If you want to tap into the pelvic floor, you're not sure how to find it. I love sitting on a therapy ball or a yoga ball, whatever you want to call it. Sit on that ball and it's nice and domed on top. And so your pelvic floor is sitting on top of that dome. And so you should get that tactile input of feeling that ball up into the pelvic floor area. And your goal during that is can I lift my pelvic floor up off of the ball? Okay, cool. Or can I relax down and kind of bulge down into the ball and put pressure down into the ball with the pelvic floor muscles? So that's both working on, can I contract up off of the ball? Can I relax and bulge down into the ball? And so that's kind of working on some coordination and trying to gauge, can I do a really good job lifting off of the ball, but I'm really struggling bearing down and pushing into the ball? Then focus on that. Focus on relaxing and can I push down, especially if you're doing birth prep. This is great. Sit on the ball and you can work on your push prep there. Can I do a little breathing and expand and press, use my breath to press down and open that pelvic floor into the ball. That's one of my favorite things to do.
That's a great tip. I've never thought about that actually.
I love the birth ball for all pregnancy stuff is great.
Yeah, yeah. I think sometimes it's frustrating for women who are trying to do birth prep to find their pelvic floor. I mean, we've done this before where we have to sit there on our hands and go, oh, there it is. I've found it because I really feel like we're so out of touch with our own bodies, especially our pelvic area, because of what you said before with like the taboo and if there's ever been any trauma or if that's where you're holding,
Yes.
harder to access that. So
Yeah, absolutely. And it's one of those things, especially if you're planning for a vaginal birth, I super encourage every woman to get a handheld mirror and start getting familiar with your pelvic floor. And I think every woman should be able to do that. And this actually took me a while to feel comfortable with it too, is being able to look at your own body and do I know what it looks like down there? Can I track if I'm having, especially postpartum, if you had a tear, can I check myself and know what it's supposed to look like? So I really encourage getting comfortable with looking at your own body and knowing what's normal, what's not normal. And that can help, I think, break down some of that barrier of like connecting to the pelvic floor.
it also felt really empowering just to have you say that. Like it reminds me of like a hippie kind of thing to do, like take back your body, you know?
Yeah. Yeah. I mean, and this is honestly one of those things that a lot of women really struggle with. Like I tell them, okay, I'm going to pull out a mirror and I want you to see what I'm doing while I'm doing some internal work or whatever. Or I want you to see what I'm looking at. Like, what is this red spot? Let's take a look at it together. And a lot of women will be kind of like, you can like physically see them kind of cringe and pull away. Like they don't want to look. And it's like, we need to get over this and we need to accept our bodies. And is it something beautiful that you want to have a picture of your vagina on the wall? No, probably not. But you should be able to know what your body looks like and know how it functions. And that'll help you take better care of yourself.
Mhm. Yeah. Well, I am looking forward to having you in person, hopefully, at some of our classes so that people can ask you questions and you can show us some of this stuff. Um, until then, I'm looking forward to sharing this conversation because I think it's really valuable and people really need to know how to take care of themselves, how to just start getting to know themselves better. So I feel like all the stuff that you just said was really good guideposts for getting
Great.
started. Yeah.
Thank
So
you. I really enjoyed it.
yeah, me too.